In this video, we are going to talk about the vital signs of recovery and do the practical demonstrations. My name is EpMac and welcome to EpMedic.Firstaid, a channel designed to equip you with theoretical and practical skills in basic life support in first aid. It is very important for the first aider to check for the vital signs of recovery in order to ascertain the next course of action to take in order to save life. This is done by checking the airways, breathing and circulation. After having done all this, you can then proceed to stopping bleeding, check for the signs and symptoms of shock, treat wounds if any, and immobilize the fractures before transporting the patient to the hospital. Now, let us run through the sequence of action together, which is as simple as DRABC. You may also call it Drabc or Dr. ABC. D stands for danger. Call the ambulance on an emergency number like 111 or any other number depending on the place where you are located. Shout for help from bystanders, those who are nearby you. Put on surgical gloves. Check and assess if the area is safe for both the patient as well as you, the first aider. R stands for response. Arouse or speak to the patient to know whether he or she is able to respond to verbal command. Tap and stimulate the body to know whether they are able to respond to stimuli. This helps the first aider to know and understand the level of consciousness on a patient. A stands for airways. Check if the airways are clear by tilting the head far back whilst lifting the chin to extend the windpipe. Open the mouth to check for any obstructions like loss of blood, broken teeth, false teeth, food, or any other things that may cause the interruption of gaseous exchange in and out of the lungs. Remove if any. Support the head and immediately place the cervical collar to maintain the airways. B stands for breathing. To start with, loosen tight clothing to free and expose the chest. It gives so much assurance to the first aider just to learn that the patient is still breathing. Freeing of the chest must be done regardless of whether the patient is male or female. Now, I must emphasize here that high levels of professional conduct must be exhibited by male first aiders when handling female patients. Secondly, bend over the patient to check whether he or she is breathing by feeling for warm air coming from the mouth and the nose during expiration. Observe by looking at the chest to see whether it is rising and falling without any restrictions. Listen to the breathing sounds at the same time. The normal breathing rate is between 12 to 20 breaths per minute. C stands for circulation. Feel for the pulse on the radial artery found at the point of the wrist just below the thumb, or on the carotid artery at the point of the neck just by the side of the throat. The normal pulse rate is between 60 to 80 beats per minute. After having done the DRABC, you can then start treatment by stopping bleeding if any, check for the signs and symptoms of shock if any, and treat wounds if any, immobilize the fractures if any. Check whether the condition of the patient is improving or deteriorating by constantly monitoring the airways, breathing and circulation, and check for the signs and symptoms of shock, which is expected to have improved after treatment has been done. Handle the patient gently and keep reassuring him or her, and immediately transport the patient to the hospital for further medical attention. The first aider should assess the mode of transport to be used. It can be by hand or by the use of the stretcher. Well, we have come to the end of this video on the vital signs of recovery. Join me in another video.